But we want to jump into our next point and say like the cause of pain. Now, much like most musculoskeletal injuries, would you probably agree with me, Rebecca, that a lot of injuries are a combination of like the two extremes? We either have complete inactivity that can cause knee pain, and we can
Hmm.
also have the very obvious that we were kind of already alluding to in the beginning, overactivity with like athletes and everything. So,
Definitely.
how about you tack on some of like the athletes? Like, what are some of like the causes and kind of like the common things that are going to create that front of knee pain?
Yeah, so I see it a lot, especially with the running population, right? So I
Yes.
work field hockey, so we do have some running involved, and especially their conditioning sessions, we get a lot of athletes that will have that anterior knee pain because they're not used to the pounding. Now, it can be due to, shoe type, it can be due to the surface, the changing surfaces that they're running on. But it can also be due to, again, we talked about that Q angle. Some of the times it's just like a muscular overuse, right? So if your muscles get really tight or your tendon's not used to being pulled that way, that can be a cause. So yeah,
Hmm.
the fun thing about anterior knee pain is there's not usually one specific like this is the this is the cause. So sometimes you got to kind of rule out a couple different things first.
And it's kind of like a stew. It's probably usually if you are in the overactivity, it's not like it was just this one specific thing you were doing.
Hmm.
It's like, okay, it was the way you were running, it was the shoe that you were in. It's like the lack of conditioning that you have for actually strengthening like your quad muscles. It's probably like a lot of small factors that none
Hmm.
of them by themselves sinks the ship, but when you put those stones over top, it brings everything down, right?
That's what makes
Yeah.
chronic injury such a challenge.
It does. It does. So, yeah, definitely. I think we were talking quite a bit of the running athletes as somebody who ran cross country, track and field
Hmm.
through college myself. I ran into plenty of issues. In fact, they actually call like the typical patellofemoral tracking or the patellofemoral pain. It does actually frequently just get the nickname runner's knee, right? Or like,
Hmm.
yeah, and whatnot. Or we also have like a jumper's knee as well too, which is also going to pretty much be on the front of the knee and kind of effectively be like a like the patellar tendon has like a tendonitis, correct?
Hmm.
Yeah. So then once we get, I know we're spring here, so track and field's not far away. We're thinking
Hmm.
like the long jumpers, the pole vaulters, the high jumpers, correct?
Yep. Yep.
Um, Certainly, I know you get the outfielder that needs to jump up in baseball, right?
Oh yeah.
I actually have another person that I'm going to pick on in baseball. Sorry, baseball players, but catching, being the catcher has got to be one of the toughest things on knees, just like that constant load in that deep squat,
Hmm.
correct?
Yeah, and that's the other thing I was going to mention, right? So we have our running side of things, but
Hmm.
also if you're lifting, right, that
Correct,
can also
yes.
cause anterior knee pain, right? Especially if you're lifting too heavy, your form's not right, you have some weakness and you're compensating because you're trying to lift too heavy of dumbbells, maybe trying to be too cool at the gym or something, We've all been there sometimes, but I think sometimes that can also be a really significant cause of that
Yeah,
that deep squat motion if you're
yes.
not having the load if your body's not able to hold that load, it can
Mhm.
also really cause that anterior knee pain.
Yeah, yeah, absolutely. And I think that all got hit pretty well. And we alluded to from the beginning to the weekend warrior, where you went from it's that first spring day that's nice. We all know it's coming, that first 70-degree weekend, and you're like, I'm going to go run 2 miles. Well,
Hmm.
if you haven't ran 2 miles in 6 months, your whole system, your whole hamstring, quad, and just knee joint, and just everything neurologically, muscles, soft tissue, joint wise, it just might not be up to the task on
Right,
that.
right.
So going to the other extreme though, inactivity, because we don't want to just sound like we're tailoring this to just athletes, because we definitely see lack of activity be a major problem. Sedentary, we have a lot of people that work desk jobs that maybe don't
Hmm.
stand up and get up quite enough. We're going to get into this a little bit later when I go over assessment philosophy, but when you're sitting, frequently you're keeping that knee hinged at that 90-degree angle, and you just kind of get like this sort of creep that sets into the tissues, and then that can actually create a bit of a functional problem that actually creates a knee pain that would look almost similar to somebody who is the running athlete.
Hmm.
So it can live on both extremes. The good thing is both you and myself and our offices are good at handling whatever the cause is. We'll get to the
Absolutely.
root cause of it and get some treatment on it and get you feeling better, right?
Definitely.
Yeah.